Bob, just a quick thing. Salons and gyms, they're out to open immediately, correct?
The word we just received, gyms can open tomorrow, salons can as well. And the only request, while gyms are not required to test their employees at this time, salons are required just to make sure their employees have a negative rapid test. And as soon as they do that, they're good to open.
Okay, can I ask my question now? Is that all right? Okay.
Go ahead, Patrick.
Okay, while deciding to close down New York City restaurants, Governor Cuomo said he's going to take this weekend to look at the data and make a decision on restaurants elsewhere. We already have restaurants in the orange zone that are closed, but there's a chance that all could have a capacity reduced to 25%. Is that your understanding?
I don't want to guess at this point. I did hear the governor say he wants to take the weekend to go through the data. He does. So I would say on Monday, if he is going to stick to that date, which he mentioned today, we'll have a little better sense of any changes up here. I did hear explicitly New York City indoor dining is shut down, I believe, immediately, and other restaurants could be impacted. We advocate very well up here as well. We really get the data to people and the governor's team almost on a daily basis. And we've said that the salons and gyms were not spreaders. Restaurants, not as much. I think bars have had some issues with the close contact with people, and obviously the social gatherings in homes. But I don't want to guess what the governor may or may not do. Our goal right now is to keep doing our best to get the word out, reinforce the guidelines, and get these hospitalization rates going down. As you heard today, the Finger Lakes is the #1 per capita region in the state for hospitalizations for COVID. We don't want that designation. We drive those numbers down. That is how we get out of these zones that are closing down or impacting these businesses.
All righty, thanks.
All right, Tanner's next.
Hey, Bob, how are you?
Oh, Tanner.
So it seems like the governor, based on these new cluster zone metrics, is kind of taking more of a hospital-centric approach. Can you kind of talk about the new guidelines, so to speak, or the new requirements for these zones on the hospital end of things, and just where our region stands based on your conversations?
We are bumping right up to the edge of those restrictive areas with our hospitals. I mean, the numbers have gone up quite a bit. We have the highest per capita. We're not there yet. I will say we are so fortunate to have URMC and Rochester Regional Health here. These two systems work together. They collaborate, they innovate. They're doing a great job with this. And a good thing about the governor's announcement today, he did not say he was going to shut down elective surgeries. He was going to give the hospitals the flexibility to work through those numbers. And I'm confident these two systems will keep doing that. I'm going to call later on this afternoon. I want to give County Executive Adam Bello and also Dr. Michael Mendoza from the county both kudos, who host these meetings, and they're with URMC, Rochester Regional, all the healthcare professionals in these different systems. We meet 3 times a week, and I'm just amazed at what these hospital systems are doing right now to manage this. And what I'm learning too is that maybe today, 70 people walk through the doors at these systems to go in as COVID patients. But on that same day, maybe 55 or 60 or 65 go out. And there's other areas we're looking for. There are patients from nursing homes who are in hospitals right now. And I believe that the latest number I saw is at least 80 beds that could be freed up once we can establish a COVID-free facility, or COVID-only facility for these patients to be discharged from these hospitals and free up bed space and staff for those going in who are sick. And these are some of the rules that we certainly understand and abide by, and we're working right now on trying to identify this COVID-only facility for these patients who are relatively healthy, coming out of a hospital, but just based on the guidelines established by the State Department of Health, cannot go back to a nursing home.
Next up, Randy Gordman, WXXI.
Hey, Bob, how are you?
Hello, Randy.
Hey, good. Different subject, but in terms of your chamber work, a lot of small businesses around here. As you know, it's make or break season, especially this month for a lot of these small businesses. What's the chamber doing, or what can other people do to, keep these folks in business? The ones that are open, it's got to be a very, very dangerous time for them if their businesses are doing a lot less in terms of sales this month.
Thanks, Randy. We are joining others in an effort right now to provide gift cards. We're going to give all our chamber employees gift cards this season to go out and identify chamber members and restaurants and these businesses most impacted. We're calling on other businesses to do that. I'm going to give Dr. Art Papier from Visual DX. He is championing this effort. We're really trying to get widespread support. And I would ask those companies who have really not been impacted throughout this whole COVID pandemic to look for ways to provide their employees with, as gifts, as thank yous, gift cards to these restaurants, these salons, these small retail businesses that were shut down or just maybe getting back open now, to help them to recover some of the economic losses that they've had. So that's what we are doing. We're doing it consistently out there. We're trying to help any way that we can. On the other hand, too, Randy, I know that people don't realize what goes on behind the scenes. We spend every day listening to small business owners and employees, getting that information back to the governor and the governor's team. And I want to thank the governor. His decision today on gyms and salons, well, probably not just from the Finger Lakes region, but we have been just relentless getting information back, because the data that he showed today is the data that we have here. And I've been joining in that effort with Dr. Mendoza and County Executive Bello. We have constantly put that information out, and it just shows that while we don't make decisions here at the local level, we do not. We provide information every single day and help the governor's team make decisions. And I thought today was just a great outcome. Even though our numbers are not going down, the governor recognizes the impact that this pandemic is having economically. And I think the announcement today was a good one. Now, he did mention he'll do some analysis over the weekend on the other data points. There may be some new announcements on Monday, I don't know, relative to restaurants or other areas, but I can assure you, we're looking for every way to stay open. And so the hospitalization rates, we're trying to keep driving down. The openings, the announced today, are very helpful. And those that are still suffering, I think many hands make light work. So hopefully people will listen and get gift cards. On a personal level, I'm married to a great cook, but I bet we have takeout 3 or 4 nights a week at least. Do we need to? No, we want to help people. We go to different restaurants and take food out. And I would encourage people, give gift cards, tip the delivery people, the servers, help people get by these very, very difficult times.
Great. Thanks, Bob.
We'll go back to Tanner from 13 Man.
Hi, Bob. So I know that obviously on Monday, we're going to learn more about the new changes to the designation of the cluster zone, so to speak. But do you anticipate a different approach rather than seeing, having to go down to a certain street level to see if there's a place in the orange zone or yellow zone? Do you anticipate a change to that? Do you think there's going to be more county-wide, region-wide, zip code-wide, or is it going to still be, do you think, that specific? What type of changes could we expect?
It's hard to say where that will go. I think the governor's intention with these cluster zones is to shrink the area of closure down as much as he could. Obviously, is it an exact perfect science? It's not. It's trying to follow the data as best you can. We had businesses that half in one town, half in the other. We had one side of the street closed, one side of the street open. Listen, we get that. We get a lot of calls and emails from people on those things. But as opposed to an entire area being closed, I think he looked for ways to try and minimize that. But I do believe his acknowledgement today with the data that the salons and gyms were not the spreaders, that they were still looking at ways to, as best encourage people in these social events, gatherings, homes to please be cognizant of this spread. But his announcement today was very, very helpful. And we have already an array of phone calls, emails here with owners who are ecstatic by that. So I think it's hard to point to it. And I always say this, nobody has ever run a pandemic. I've had enough things I faced in my careers, but never a pandemic. The governor's never led during a pandemic. Trying to look for ways to limit, and sometimes you're trying to reduce the harm you do or the impact, but slow the spread. So I think it's a constant flow of experimentation. And, for those that are on the sidelines criticizing every day, hey, you know what? There are people out there working every day trying to make things better. It's easy to criticize. It's easy to point fingers. It's much harder to make decisions that you're trying your best to have an impact on this disease, but reducing the impact on people and their families economically. So it's hard to say where that will go, but I do believe the announcement today is telling us that the governor is trying to reopen as best he can. And we still have, I think, one of the top 5 infection rates, lowest infection rates in the country. So in essence, on a large scale, we are doing well. But up here right now, Western New York and Finger Lakes, we are really getting hit pretty hard. I think hardly a day goes by I don't hear from a friend, a colleague, or somebody, they've contracted the virus. So it is crazy times right now. We can't urge people enough. I'm going to put something out that I think has to be said that has not been announced yet. You know, we're getting word that travel sports teams, youth travel teams, hockey and others are abiding by the rules here in New York State, but then going out of state, primarily to Pennsylvania, for games on the weekends and playing 2, 3, 4 games or 2 or 3 days of constant games there and coming back home. I played sports my whole life, and I know travel teams, travel hockey, other travel sports are important to kids and families, but these are events where a lot of times families travel together. They're in cars, hotels, going to playing, and it is going on. Is that a spreader event? I don't know the data right yet, but there are a lot of people who are calling and saying, hey, this could be a real issue. My kids in travel hockey, this is what's going on right now. And I just think that before there is enforcement or steps taken by somebody along the line, just to warn parents that please don't push the envelope on this. That we're going to get over this hump at some point, but these types of events could end up being part of bringing something back to a family, back home here, following maybe a weekend of games in a different state.
We'll go back to Patrick from News 10.
Thanks again. Bob, going back to the restaurants, contact tracing indicates that restaurants only make up 1.4% of cases, yet they're being targeted. Now, wouldn't this force more people to go to home gatherings that make up 3/4 of the cases?
Well, again, it's hard for me to make a statement on what people do if this is closed. You know, with the restaurants, with either the outdoor dining, the percentages, the takeout, we're trying to support them and keep them going. But I think people have to realize, listen, you may want to gather, and nobody wants to tell somebody, no, don't get together with 10 of your 20 of your friends for a Buffalo Bills party Sunday night. But these are the things that we're seeing pop up, and I've heard again friends and colleagues of mine to say recently they have contracted the virus. They have no idea where it came from. I think I heard one came from a child's party. So a small group of 3 or 4-year-olds together, and that spread. It's again, this virus is just spreading like crazy. And it's right now, it's just hitting Western New York and the Finger Lakes as hard as it hit last spring. So I guess the point I would make, whatever decisions are made to either open or close, I think that the governor's team are doing their very best. They're opening up, again, salons and gyms, effective with the announcement today. Restaurants are, they're a big part of our culture, a big part of our business community. I'm hoping that these numbers go down so they can stay open, reopen, and bring our business up. Obviously, outdoor dining is not really, the optimal dining upstate New York in December, January, February, and March, just due to our climate. But if we drive these numbers down, I think that you're going to see more and more openings and opportunities. And I would just say we all have a responsibility. And go back to your point, is it right if I can't go to my favorite restaurant or bar to go to someone's house with 25 people? No, it's not. It's pretty clear what we should keep at. And even now they're saying when you're in the house of people, wear a mask. And for all the people complaining about masks, I do think they work. Are they perfect? Probably not. I am not a doctor. I wear a mask. I leave, I'm in my office right now. I go out, I have a mask on, go back to my car, back and forth. I go to business, I wear a mask. I got my hair cut. The salons that I've seen and the gyms do a great job. They wear masks, they disinfect. Some are wearing face shields. It's something people say it doesn't work. I think it does work. I think half the problem we have now is all the disinformation and the political back and forth about what we should and shouldn't do, our freedoms are impacted or not impacted. Most important thing is a lot of people's economic status has been impacted, and not by in most respects, their behaviors of others who come in and frequent their establishment. So I just think we have to all just say we're in really uncharted waters right now. just to be diligent, be disciplined. Let's get through this. And I believe with the vaccine coming and these habits and guidelines just reinforced stringently, we're going to get through this faster than we hope to. And I think if we don't, we're going to be in this for a long time. And every day, these cases are popping up. And I think people to keep in mind is hospitals, their capacity goes up. If they get overwhelmed, then people with cancer, with other operations who need medical attention, they could be in harm's way because these facilities are being overwhelmed by COVID. So I think we all just have to be super, super careful. Don't cut corners and just really try and follow these. And I understand frustration, fatigue, we get it. We are probably the point of most of frustration for people here at call all the time. We don't make decisions. We don't announce those. We have no authority to open or close any establishment or business. What we can do is listen, as we do, and follow through and make sure that those making decisions get the best information we can provide from this region. And I'm here to say, I'm happy to say that leaders around this region involved with the control room and governments have been very, very good about doing just that.
And I think we have one more from Tanner with 13.
I just wanted to one follow up on the first question I asked, Bob. You mentioned that there's been, at least I know we've been hearing from healthcare leaders for a couple of weeks now about trying to designate a facility for like nursing home residents who have, could leave the hospital but have not yet tested negative. Is there any location being eyed right now?
Well, we've discussed a couple, and here's the point. We've discussed doing it by wing, by floor. That does not provide enough safety for the guidelines. I mean, I think the governor and his team are very diligent. They don't want to see one more infection going into a nursing home. Obviously, the first people to get vaccines will be nursing home patients. So you can see the attention being paid there. We are discussing some locations. It's hard. It's hard to find one location. And sometimes a location does not want to be designated as a COVID only for fear of down the road that could impact their business. So that's a consideration. The next issue is staffing. These hospital systems, their staff is really being strained right now in so many different ways. So it's being discussed. There are a lot of smart people working on it right now. It has not been decided upon yet, but we are working at it. And it's also an issue in Western New York and Central New York, other areas of the state. And I'm going to call probably in less than an hour with the hospital systems. And I think every time we have this call, we're discussing updates, but there is no definitive place yet that's been identified. And once we can get one, we can free up probably today at least 80 plus beds in our local hospital systems.
I think that'll wrap it up. Thanks so much, Bob. Thanks,
Okay,
everyone.
thank you all. Thanks very much. Have a great day.
Thanks again. Bye.